why don't you give us an overview of the SERENA-6 study? I know there's been a lot of discussion about that recently, and certainly mixed reactions to the data. So maybe give us an overview and sort of set the stage for our discussion, if you could.
So SERENA-6 was presented last year at the ASCO plenary. It garnered a lot of attention and excitement. It was, in some sense, a paradigm shift in how we think about treating patients with metastatic breast cancer. The idea is for patients who are on first-line treatment with a CDK4/6 inhibitor and endocrine therapy to monitor those patients with what's called ctDNA, or circulating tumor DNA, and look for the emergence and detection of what's called an ESR1, an estrogen receptor resistance mutation, and then to intervene with an oral SERD called Camizestrant. And it was a randomized study, meaning that half of the patients who developed the ESR1 mutation were randomized to switch their endocrine therapy to Camizestrant, while the other half of patients did not receive the Camizestrant upon the emergence of the ESR1 mutation. And what the main finding of the study was that patients were able to stay on that line of therapy, essentially that progression-free survival was longer when Camizestrant was initiated when the ESR1 mutation was detected without any evidence of clinical or radiographic progression of disease.
Thanks. That was a great overview. I thought this trial design was so unique and really set the stage for thinking about proactively responding to tumor changes rather than reacting at the time of radiologic progression like we normally do. One thing that I think maybe hasn't gotten as much attention as it should is, some of the data that looked at the complete clearance of the ESR1 mutations. I think that was presented later, maybe at San Antonio. So if you could comment on that and really, some of the ctDNA clearance data and specifically why that is, kind of worth digging into a little deeper.
As far as ctDNA, it essentially serves as an early marker, potentially, of response or resistance. And across many trials prior to SERENA-6, we've seen that we can basically detect progression of disease or response based on clearance or increase in ctDNA. So it's exciting to see when ctDNA is decreased or even cleared, that's a good sign in terms of we are targeting the actual mutation, ESR1, and having it cleared to prevent or anticipate that progression of disease so that does not happen.
Yeah, I think it, really the efficacy is there. That data really supports that. And it does make us think about really the importance of keeping patients on that first line treatment as long as possible. Certainly from a treatment perspective, but also just from like a quality of life standpoint for patients. I think sometimes that time of first progression is tough for people. And so, sort of along those lines, I think, there is this unmet need of, thinking about why early action matters. And so, before disease progression. So, if you could speak on, the importance of kind of what this trial brought to light, potentially acting before radiologic progression, and what that means really for patients as well.
I think you brought up a couple of very important points. I think one is we think that acting earlier matters. I think intuitively that should be the case. And it's difficult, it's challenging to design the right trial to be able to show that. But I think what made this trial potentially very meaningful is we were targeting a specific mutation that we know to cause resistance in up to 40 or 50% of ER-positive, sure, HER2-negative breast cancers. Mm-hmm. And it's something that we also know that if we wait to initiate an oral SERD until the second line, unfortunately, those drugs do not work as well as we would hope. So the idea is, can we use these drugs earlier in order to improve clinical outcomes and keep patients on first-line therapy longer?